People first organizations will win in the future of work.
Your only real asset is your people.
We all want purpose-driven work.
HR-led organization is the
I'm
future.
sorry, but leaders don't lead empty desks and empty shop floors.
Welcome to the People Strategy Leaders Show. I'm your host, Sri Chellappa, founder and president of Engagedly, and a serial entrepreneur in technology, films, and music. This is where we talk to people leaders, business strategists, and organizational savants about leading in the time of change. What is working, what is not working, and more importantly, what we should be thinking about. Stick around to the end of the show. We will reveal how you can be our next guest. And now, let's engage. Hello, and welcome to People Strategy Leaders Podcast. Today, I'm joined with Melissa Davis. Melissa Davis currently serves as the Director of Marketing and Business Development at Holzer Health System, where she also runs the employee communications programs. With over 17 years of healthcare experience, she has diverse background and understanding of many disciplines, including both acute hospital and outpatient clinic settings, long-term care, and pharmaceutical marketing. Bringing 25 years of marketing and sales experience, she has learned to analyze, adjust, strategize, and create marketing plans that provide measurable results. Melissa discovered her love for healthcare and blended her interests with an intent to learn the industry and help to initiate change and out-of-the-box thinking with strategic approach. Melissa is a believer in always asking questions and determining root cause before strategizing or implementing, asking the what if or what not or why not questions before taking actions. Throughout her time at Holzer Health System, she was able to embrace the strategy when creating action plans for crisis communication during the recent pandemic. Melissa is also a client of Engagedly and the employee app, where she uses that product to run her employee communications program. Well, welcome to the show, Melissa. It's an honor to have you on the show.
Thank you so much. I'm happy to be here today.
So, Melissa, explain to me what specifically is your role. I know you wear two hats. There's the marketing and business development, and then there's the employee communications. In the context of employee communication, like what is your role? What are you trying to accomplish? What are some of your strategies there?
Sure. So I think you said it perfectly. So we handle, of course, all the business development within our regional healthcare system, and then the marketing that comes as a result of analyzing those business opportunities. But on the marketing side, there's several things that are housed there. One of which is employee communication, and I think depending on the healthcare system or the organization, that lives in a lot of different places. But for us, it's always been within the marketing team. And so we have allocated a full-time employee to kind of help manage those efforts across the system for the last several years now. And so for us, we've become the hub or the clearinghouse for all things outside and externally throughout the system for patient outreach. But we serve a lot of different clients within the marketing department. So we always say, we serve our patients, we also serve our providers. And then as a marketing department, we also serve our own staff. So we have just over 2,300 employees across 7 counties in southeastern Ohio and West Virginia. And so we have 2 hospitals, 20 outpatient clinics, I believe, and then several other skilled nursing facilities, ambulatory surgery clinics, freestanding emergency departments. And so as you can imagine, with that many different facilities, communications is not always simple or easy, right? And so, but we're tasked with making sure that we're able to communicate with all of those employees throughout the system.
Yeah, so employee communications, a lot of organizations make that a priority and dedicate an individual like you to run that program. In many organizations, it is HR or the leadership doing it over email and other mechanisms. Why is a more targeted focus on employee communications important, especially as it relates to, your organization, but also healthcare more broadly?
Sure. I think it's always been important, but if we didn't recognize that before a global pandemic, we do now. right? Just really getting information out in that timely manner, especially when you look at a workforce. I was reading an article the other day that mentioned globally, 80% of the workforce is deskless, not in front of a computer all day. And we are very similar to that in the healthcare industry for sure. And so when we look at our frontline staff, we recognized certainly during the pandemic that we were missing an opportunity to get timely information to them in a way that worked best for them. Historically, we've used a lot of email. And email works when you're sitting at a desk or you have the time and the opportunity, but it doesn't work for those that were extremely busy during that time, but also needed the same information as the rest of our workforce.
Yeah, and the biggest challenge with email, I mean, at least I've noticed it lately more than ever before, is how many unsolicited emails I get from external sources. It's crazy. It's like I feel like my email address is published everywhere, and I get literally 20 to 30 emails that I delete every hour. Every hour.
I agree. And I think you're right. When we just had a conversation the other day, like I said, our deskless population, it certainly didn't work for, but even those that are able to access email throughout the day are not as in tune as they used to be because of the clutter and because of the noise that's in that inbox. And so we're constantly looking for more and better ways to make sure that really important information, whether it's an open enrollment or a inclement weather, whatever the case may be, or an emergency, we need to get that information out timely. And so we're constantly trying to look for new ways to do that.
Yeah, and I think a lot of organizations still rely on email or sometimes even voicemail, which is not always very helpful.
Yeah.
So in your employee communications, if you were to think about what are your top 2-3 goals, how would you describe that?
I would say that our top 2 or 3 goals, when we look at it, the biggest goal was to get in front of more people. So when we pull analytics on things we do a couple of different things. I should back up. We have a weekly communication that we send out. It's actually daily, but it's published weekly. And so we call that the daily huddle. And it's intended for leaders throughout our organization to huddle with their groups for a brief 5 to 10 minutes and put information into that, which works, except that it's published on a weekly basis. And so if something happens between that time frame, we're not always able to get that out. And then we have, of course, newsletters and emails as well. I think our biggest goal and objective was to find a way to get more information out in a timely manner. So when things happen right away, we need to get that out, be it a good announcement, be it something that people need to be aware of right away. I mentioned inclement weather. We've had a lot of that in January, and really when we have adjusted hours in some of our clinics or limitations with things, that's something that can't wait to the next day. And so we've been faced, I think, over the last, I'll say 3 to 4 years, especially, that's been a challenge for us, is how do we make sure that every employee understands the adjusted hours, or understands the crisis, or understands the emergency that's going on at that time. So that's been a huge goal of ours, is just exploring more ways to get that information to everybody.
So in your experience of doing employee communications, can you talk about how many years you've been doing this in this organization, and what was some of the key triggers that led you to say, we really need some more dedicated approach to employee communications, and this whole email, mass mail approach is not working?
Sure. So in all my years of experience, the one area that was discussed before I came into this role was crisis communication. And I mentioned that was probably an area that I had not spent a lot of time prior to this role. And ironically, I came into this organization and assumed the role of crisis communication as well in February of 2020. And so it was just a short few weeks later that crisis communication became almost my full-time role, right? Because everything was a crisis and everything needed to be communicated quickly. And so not that that was a good thing, but I will say that it dismissed everything that we had done prior to that moment and gave us the opportunity to say, what are the needs and how can we change things out of dire necessity, really. We knew there was a need going into that, but I think during the pandemic is when, especially during those first months of the pandemic, we realized that there is a dire need to get in front of our employees as quickly as possible. And as a result of that, we really started not just brainstorming, but really exploring and actively seeking a solution for that.
So what advice, now you obviously have some lessons learned, things you could have maybe done maybe better, or things that you could say, if I were to teach a class in employee communication, here are some of the things I would make sure I would focus on. So if somebody coming into this role in a different organization, implementing employee communication program, what would be your key advice and lessons learned would you pass on?
I think one of the biggest aha moments for me, or learning points, and certainly I would have done it, conducted things differently, is to really visit with that frontline more and earlier. Because, and that goes back to my love for all things root cause analysis, is you may think you know, but until we really start asking questions of those that are experiencing, we don't know, right? And so we need to either shore up the fact that we do know the roadblocks that are in the way, or pivot, but we've got to accommodate those that have the need. And so, ours came out of, like I said, a dire need in a time where we needed something right away. But I think if I had that part to do over again, I would certainly probably have conducted more focus groups from different areas. We certainly focused on nursing, but there are so many departments and service lines within our organization that I think we probably could have learned more from earlier.
Yeah. So the pivoting a little bit, in terms of using a platform like the employee app in this case, what are some of the key aspects of that platform that you really find effective and useful as you went about using? And then I guess I would also paraphrase that with what made you choose this platform in the first place that drove the decision.
Yeah, I think for us, as we started to look at our workforce, I mentioned the older or antiquated ways that we had maybe done some things in the past. But when we really started looking, we know not only are those employees without desks and without access to email on the regular, but that population segment of our workforce is very busy, right? Mm-hmm. All day, every day, and their number one priority is oftentimes not internal communication. Even when important things are coming out, their priorities are the outcomes and the safety of our patients as much as anything. And so what we started to learn is we have to figure out where we can fit in and filter information to them in a way that they best receive it. And I think for us, that's when we started realizing that something like an app on a mobile device made sense, first of all, because it's something that's readily accessible on a staff member's phone or device. But I also think the part that has become most appealing to a lot of our employees is the fact that it's small bits of information that they can access when they have the time. And it's still there regardless. And it's not, as we mentioned, the clutter of the emails and that kind of thing. And so I think that's what made it so appealing for us, is something that employees would voluntarily want to visit. And we've seen that happen within our organization. But then also be able to scroll and use that time to really look at two things, the need to know and the nice to know information. And so we have found that different information draws different employees to the app, but knowing that they can find it all there and really kind of honing in on that and making that app a resource for them has been a big priority for us.
Excellent. As you're looking forward into the future, what are some of the new or innovations you want to do in this space in employee communication in your organization?
So we are, I think our biggest opportunity for growth is still with the app. We are just approaching our 1-year anniversary of launching the app, and we call it the Holzer Hub. And we've had a lot of really good success with it. So of a workforce that has roughly 2,300 employees, we have about 900 that have adopted right now. And so we're very happy with that, but we know we still have room to grow. And so with that, we are looking to expand the resources that are available to them through that app. A big part of that is visiting with our nursing staff, for example. They have, different ways of scheduling, and when they have a need or a call off, they need a way to get the information to as many as possible so that people can pick those shifts up. We're currently exploring some opportunities there. I believe if we're able to find some ways to integrate that into the app, that will become much more of a resource for our nursing staff in particular, and will allow even more traffic and engagement on the app. Another one, I know I just mentioned inclement weather, but that's a big thing here in Ohio, certainly during the winter months. But we're currently exploring, after some of that weather, but exploring more ways of getting that information out real time so that people identify the app as not only one of many sources, but like kind of the resource for them to be able to find the information right away.
Excellent. Well, that really helps, Melissa. This has been an honor to have a discussion with you and really learn a lot about how you're using the product, but also in your role of employee communication, what are some of the key imperatives are. Is there anything else you wanted to add that other professionals in your space would learn about or know about?
I will say, you asked me if there was anything I would do differently, and I think that we probably were guilty, and we are as an organization, at maybe overanalyzing before we jumped in. And so we took our time in evaluating, and certainly hindsight is 2020, but it's something that my team, I know, wishes we had jumped into a little quicker. Being on the other side of things, we've seen so many advantages, and not only has it helped us get more information to more people, I think having the app has helped us to empower other people throughout our organization and given them some autonomy to be able to communicate that out as well. We do house internal communications within marketing, but that doesn't mean that we always are the first to have that information, right? And I think that's within any organization. Sometimes, we hear about it, but there's a delay. And so what I think has been most helpful, and what I would encourage others to do, is to build those relationships throughout, whether it's human resources. We have an entire education team that does a great job. We've identified several key stakeholders that I think we've been able to empower with that information as well. And they're able to help us distribute information. And the more we do that, I think the better the app will continue to grow as a resource for our employees.
Excellent. Well, thanks, Melissa. It's been a pleasure talking to you.
Absolutely. Thank you. Have a good one.
Shri Chellappa here. Thank you so much for listening to the People Strategy Leaders podcast. If you are a successful leader or a people strategist who would like to be on this program, please visit engagedly.com/People Strategy Leaders podcast. If you got something out of this interview, would you share this episode on social media? If you know someone that would be a great guest, tag them on social media to let them know about the show and include the hashtag People Strategy Leaders. I love seeing your posts and guest suggestions. We are regularly putting out new episodes and content. To make sure you don't miss any episodes, go ahead and subscribe. Your thumbs up, ratings, and reviews go a long way to help promote the show and mean a lot to me and my team. Want to know more? Follow me on LinkedIn and Twitter @Sri Chellappa. Thanks for listening. We will see you next time. And thank you to Patrick Ramsey, sound engineer at Kalinga Production Studios, for recording and mixing this show.